How do you know if someone has actual depression or if it's just laziness that has taken over and in turn made them depressed? Okay, I think this is going to be a longer response to this one. So, if someone has become depressed, most likely it wasn't just caused by laziness, right? Because we can be lazy without being depressed. The depression was most likely caused by something a bit deeper. And if it is just laziness, right, if someone is just kind of habitually lazy, that's a more separate issue. And I would encourage some deeper probing and self exploration about that particular characteristic. I think it's important to distinguish here that there are two types of depression: situational and clinical. Situational depression implies kind of what it is, which is that it's a result of a reaction from an experience, such as the death of a loved one or kind of an ugly divorce. And situational depression is actually known medically as adjustment disorder with depressed mood. It often results and resolves itself in time, and talking about the problem can ease the recovery process. And then clinical depression is known medically, and what's kind of more ubiquitous is, major depressive disorder, which is more widely known, and that is a more severe mental health condition. Clinical depression can also be due to a chemical imbalance in the brain, which is a good indication that psychiatric medicine could be very beneficial for this particular diagnosis. And what this looks like is that in the brain, the influx of stress hormones, such as cortisol, which is triggered by depression, causes the amygdala to enlarge. And this is part of the brain associated with emotional responses. So when the amygdala becomes larger and more active, it causes, an array of symptoms such as sleep disturbances or changes in activity levels and changes in other hormones that contribute to feeling depressed. So when it's physiological, right, doing something solely like practicing gratitude doesn't tend to be very effective because we need to pay a little extra attention to the body and the brain. I heard this analogy about depression that really resonated with me, which was depression is being colorblind and constantly being told how colorful the world is, right? So keep that in mind next time you are trying to conceptualize what a depressed friend is going through. Okay, long-winded answer to that one, but I think that needed a little extra attention. So, okay, the next question is, can you offer some advice on getting a pet registered as an emotional support animal so that I can keep my new dog in my apartment that has a breed restriction against his breed? So, unfortunately, many places like airlines are no longer recognizing emotional support animals. So I say that just as a disclosure, right? That there is a chance you might get a registered emotional support animal and it might not be valid enough. Disclosure. However, if you feel that your animal truly provides you emotional support, then Macon Wellness does offer emotional support animal evaluations, and we can actually give your letter to you the same day of your appointment, which is actually quite rare and a really awesome thing that we can do. And then lastly, I think to distinguish here is important between an emotional support animal and a service animal. So a service animal is a much more intricate and intense process, which usually involves a medical disorder rather than a psychiatric disorder. I think you can get it as a psychiatric disorder, but it's less common. So for example, like service animals are helpful for an individual who is blind, right? Where the dog actually acts as a service to that person. I don't know if that difference is helpful, but it was certainly helpful for me when I was learning the process. So okay, any tips for dealing with a suicidal friend? The first tip I have is to try to believe them. It's a common myth to say that someone is trying to get attention from a suicidal claim. But if you really think that to be the case, that it's just attention seeking, remember that the act of trying to get attention through such a consequential statement singles some type of red flag to begin with. right? So get curious anyway, even if you do think it's attention seeking, because lying about suicide is still, again, quite a serious claim, right? That's for the people who are kind of outright saying, I'm suicidal. For the people who don't come right out and say that they are suicidal, pay attention to their language and their behaviors, because people often um, ask or talk about suicide in a vague or unclear way, right? So an example is, sometimes I think I don't want to be here anymore, right? What is that implying? And to always make sure you're taking those statements seriously. I would say to find the courage to talk about a taboo topic, and then encourage them to talk about it also. If you are afraid to talk about suicide, examine your own belief system as to why that is, and why that makes you feel uncomfortable. And lastly, I would say, offer compassion and encourage professional support, because you're not expected to know all the right answers of how to deal with someone who's suicidal, but a professional does. Okay. Can daily use of marijuana cause depression? I hear this question a lot, and it's hard to say the direction of the association, right? Does marijuana make people depressed, or do depressed people smoke more marijuana, right? And let me tell you one of my life mantras, which is that the answer is most likely somewhere in the middle. It always is, right? And so, according to the Mayo Clinic, and I made sure to write this piece down, which is that marijuana does not change anything in the underlying brain pathology that contributes to depression. However, if you are depressed, are you more likely to turn to marijuana? Probably, right? People who are depressed, who are looking for treatment, right, are seeking out options to help reduce the impact or burden of their depressive symptoms. And when traditional treatment options are insufficient, they are turning to marijuana. And ironically, THC, the chemical in pot in marijuana that causes intoxication, has actually been shown to increase levels of dopamine in the brain. And dopamine is that feel-good neurotransmitter that directly stimulates the pleasure centers in the brain. So the idea is that might make a depressed person feel better temporarily, but it's really masking feelings that can or will return, because, and if there's anything you get out of this response, take away this: drugs don't introduce new feelings that you didn't already have within you, right? Which is why we always say to our clients who are seeking a medical marijuana evaluation, right, for a medical marijuana card, that we do not support medical marijuana as a sole form of treatment, right? We recommend it in conjunction with psychotherapy. And lastly, I think it's kind of important to note here that marijuana use and depression, they accompany each other more often than you might expect it by chance, but there's no clear evidence that marijuana directly causes depression. Most of the research does show, however, that marijuana helps more with anxiety and physical symptoms. Okay, moving right along. Can you give advice on how to communicate with a spouse who has BPD? And BPD is borderline personality disorder. So let's first start by defining BPD for the friends who don't know. BPD is a personality disorder that includes symptoms such as an intense fear of abandonment, a pattern of unstable and intense relationships. It could be kind of rapid changes in self-identity or self-image, impulsive and risky behavior. And those are just kind of a few symptoms that define what BPD is. So what comes to mind initially for me is to touch upon the abandonment would be a lot of the validation, right? People with BPD need reminders and reassurance about appropriate human behaviors. And one way to do that is setting firm boundaries and not being afraid to remind them of those boundaries, right? They just need a little bit more direction. And also in terms of these boundaries and the validation is also assertive communication. However, the partner here has to be very careful about their delivery, right? The partner has to be careful not to belittle or raise their voice, and they have to be mindful that they are delivering whatever message it is appropriately and gently, however assertively, right? There's a difference between assertively and yelling or belittling, right? Those are very distinctly different. Those are just some quick tips, but really if you're concerned about navigating a relationship with someone who has BPD, this is an excellent experience for couples therapy, or if it's just another family member, family therapy as well. It's kind of hard to capture all of that in one response. So, okay, we're gonna do about one more question here, being mindful of the time. And that question is, how do you deal with feeling like you are the problem and wanting to just poof away somewhere and start fresh? So I've been here in my day. I've wanted many fresh starts. I wanted a fresh start when I started college. So I deliberately chose a university across the country where I didn't know anyone. Then I wanted a fresh start after college. And so I did another cross-country move. The problem with wanting a fresh start is that it is avoidance in disguise. I kept thinking that if I go to these new places, I'll be better. I'll be happier. And maybe I did get away from some destructive habits and destructive ways of living and some, unhealthy people, but I couldn't get away from myself until I truly faced myself. If you feel like you are the problem, that can be a good thing in the sense that you are taking that deep look in the mirror. You're not victimizing yourself, but instead you're entertaining the question, is it me? And that can be one of the hardest realizations to address while also the most impactful, because when we take radical ownership of our lives, it can actually be quite liberating, right? So my answer to this question is to stop running. Do the work on yourself first. Take the deep look in the mirror. Go through the beautiful experience of therapy with an objective person who is professionally trained to aid in your self-exploration. Then take the fresh start and purposely surround yourself in an environment that is conducive to your new understanding about yourself and what you need. One of those first questions is, how do I know if I'm unwell or if I need to see a therapist? So this is a question that only you can answer for yourself. However, if you have encouragement from friends and family, that might be a sign to pay attention to. Also, in the 20th century, we were only encouraged to go to therapy if we had a quote-unquote mental illness, but that isn't so much the case anymore. In fact, it's much better to start therapy earlier rather than later as a preventative measure rather than a reactionary one. And while we certainly have clients meeting DSM-5 criteria for a specific diagnosis, I also see many clients who want to just get to know themselves better. I have clients who want therapy because they're lonely or they're having trouble with interpersonal relationships. So you don't need to be labeled as sick or unwell to start therapy. You just have to be curious, and you have to be willing to take a deep look in the mirror. Okay, next question here. How do we know we self-sabotage and how do we stop it? So the tricky part is that most of the time we don't realize that we are self-sabotaging, and we are quick to blame external forces for our problems when more often than not it's really the internal work that we must do. For example, it might be true that what causes you distress is your unhealthy relationship or perhaps lack of relationship with a family member. However, therapy is not about changing them. It's about changing your reaction to them. Okay, Bonsai, the therapy dog, is getting a little antsy, so he is going to leave the live Q&A. Okay, so it's not about changing them, right? It's about changing your reaction to them. So when we wish for others to change for our own benefit, that is what is termed in the literature as a healing fantasy. It's an attempt to control something that is outside of our control. Thus, we self-sabotage when we blame others and call ourselves the victim. The person you are in conflict with might be truly uncooperative or have less than decent character. That might be true, but we cannot change them. We can only change ourselves. So how do we stop self-sabotaging? We stop self-sabotaging by taking full responsibility of our lives and of our choices, regardless of how painful and uncomfortable that process might be. Okay. So how do we improve mental wellness? How do we improve mental wellness? We improve mental wellness by improving our habits. That's where I'll start here. If you have a habit of binging on McDonald's every night at midnight, you're not going to feel good in the morning, right? If you have a habit of lashing out on people in your life, you're going to quickly find yourself alone. We also improve mental wellness by understanding our why, right? Why does this trigger me? Why does this person piss me off? Why can't I find a healthy partnership? Why do I not like myself? We should be asking ourselves why to most of the questions that we have. We should ask ourselves why and get curious about these questions rather than get angry and reactionary, right? Because the curiosity is going to be more productive than an angry reaction. We improve mental wellness by going to therapy and by understanding our story through an objective lens. The process of learning to narrate your story of what has happened to you is quite powerful. And we improve mental wellness by taking control of that story. Okay, next question. What's the best approach if you feel like a friend or a family member is going through some mental health issues like anxiety or depression? This is a good question. And with this question, I will share my mantra for my professional and my personal life, which is that you cannot help someone who doesn't want to be helped. And this is one of the hardest pills to swallow, I think, especially for a lot of my parents out there. And now this doesn't mean that we have to abandon our family members or our friends. We can do what we can to encourage them, but we certainly can't force them, right? And so it's kind of about finding that happy medium. And if they refuse to address their mental health issues and continue to self-sabotage, then as I discussed previously, it's up to you to decide how much time and energy you want to continue to pour into this relationship. Now, what does encouragement look like? Encouragement looks like supporting them and being there for them to have the conversation, but it does not mean telling them what to do. And that's a big distinction that is frequently confused. A common myth is that we have to give advice to friends or family who are struggling. And I'm here to tell you that more often than not, they don't want your advice, right? They want someone to be fully present without trying to shift their perspective or judge their experience. And that's what therapists do. Therapists do not give advice. And if your therapist is giving you advice, maybe you should find another therapist. Because what happens when your therapist or friend or partner gives you advice about a very hard and complicated decision, you take their advice and then it ends up not going well or backfiring, right? It would be next to impossible not to resent that person. So we need to make these mistakes for ourselves. Okay. I'm noticing if we have any comments, and we do not, so I will power on. Okay, this is a question that I got as a response onto my professional Instagram at my therapist Kelsey, and it is, what are your thoughts on EMDR? So EMDR stands for eye movement desensitization and reprocessing, and it is a psychotherapeutic treatment originally designed to alleviate the distress associated with traumatic memories. The rapid eye movements have been scientifically proven to help the neural connections in your brain digest memories more effectively. And the science behind that is essentially that Eye movements calm down the thalamus, which is part of the brain that regulates consciousness and alertness. And while I'm not officially trained in EMDR, I cannot speak to the clinical experience, but I do know that it's been very helpful for many people. And I know that if traditional talk therapy doesn't feel effective for you, then this alternative approach, like others, could be something worth exploring.